In this video, we'll discuss about pleuritis. It is also called as pleurisy. What is pleuritis? Inflammation of pleural membranes surrounded chest cavity and lungs. Keep them production. How we will define inflammation of pleural membrane surrounds chest cavity and lungs. Otherwise, we can define inflammation of the tissue that lines the lungs and chest cavity. Infection such as flu and sudden medication can cause pleurisy. Inflammation of pleural membrane. Inflammation in pleural membrane. They may be accumulation of fluid. Here accumulation of fluid or fluid get accumulated. On the basis of accumulation of fluid, it can be divided into two type of pleuritis. One is wet pleuritis, another one is dry pleuritis. First discuss about dry pleuritis. In case of dry pleuritis, no or little fluid accumulation. By using stethoscope, doctor heard abnormal sound. Otherwise, that patient also feels some abnormal sound. Why this abnormal sound? Because of frictions. When patient breathe, where is friction between pleural membranes and chest cavity. That's why the abnormal sound is coming. So dry pleuritis, no or little fluid accumulation. Here patient feel abnormal sound because of friction. Second one is wet pleuritis. There is fluid accumulation in pleural cavity. Person also feel difficult to breathe. That is called apnea. Patient feel difficult to breathe. That condition name is called as apnea. It is very painful condition. This one is apnea is the very painful condition due to accumulation of fluid. There is increase in pressure inside chest cavity. Pressure comprising nerves. So, wet pleuritis, fluid accumulation, very difficult to breathe because of apnea. Then, very painful condition, accumulation of fluid. Then, there is increased pressure inside chest cavity, pressure comprising nerves. Next, what are the risk factors or what are the causes of pleuritis? Risk factor basically lung disorders, that is that respiratory tract infection. Examples because of microorganism, pneumonia, tuberculosis and other chest infection. So lungs disorder, respiratory tract infection such as pneumonia, tuberculosis, any other chest infection. Second one is systemic lupus erythematosus. Third condition, asbestos, occupational disorder. Then chest injury, flail chest, that means broken rib, get separate chest cavity. Then heart failure. Then inflammatory bowel disease, that is gastrointestinal tract disorder. Then pancreatitis. Then single cell disease, sudden drugs reaction. Then lupus, this one is the autoimmune disease. Then patient may get apnea, then chest pain, then shoulder pain. These are the example of pleuritis, risk factor for pleuritis. Next, treatment purpose. NSAIDs, non-steroidal anti-inflammatory drugs are given. This one will decreases inflammation as well as pain. Oral corticosteroid also given. Then antibiotic, amoxicillin, erythromycin, streptomycin are given. So treatment purpose, we will take treatment, it will decreases inflammation as well as pain. NSAIDs, non-steroidal anti-inflammatory drugs, then oral corticosteroid, antibiotic like amoxicillin, erythromycin and streptomycin we can use for treatment of pleuritis. Next, what are the diagnostic tests doctor recommended to detect whether the patient have pleuritis or not? Chest X-ray. This X-ray can detect any fluid accumulation in pleural layer or any damage in rib cage or any damaging things presented in lungs. We can detect. Chest X-ray used for detect fluid accumulation, rib cage damage, to analyze rib cage damage and any damages to lungs. Then CD scan, chest CD scan. There is any blood clot in lungs, we can detect it. By using CD scan, any blood clot in lungs we can detect. Then thoracentesis. Thoracentesis. This procedure that is performed to remove fluid from that thoracic cavity. So we are using three diagnostics method: chest X-ray, chest CT scan, then thoracentesis. Other test we can use sputum test and blood test. Um, Sputum sample and blood sample we will collect and send to laboratory. Whether any bacteria presented or not we can detected. So this is all about pleuritis. This one is the statement form. Risk factors. Thanks for watching.